Joining us.
Lubbock health officials are explaining one more reason to get the measles vaccine tonight, as the virus could lead to a potentially deadly disorder years down the road.
KCBD News Channel 11's Parker Schaffner joins us in studio with more about this outbreak and the dangers it continues to pose to the South Plains. Parker?
Karen and Abner, Lubbock Public Health Director Catherine Wells warned today that this outbreak will likely last months. But the effects of this disease could return to harm its victim again years from now. So doctors stress taking the simple steps to prevent getting it in the first place, keeping yourself and those around you safe.
Young babies of working parents are now being exposed to measles, and us as a community really needs to work to increase our vaccination rates.
Right now, the Lubbock vaccination rate for MMR is about 92%. Lubbock doctors say we need to reach 95% for what they call herd immunity.
We have a pretty high rate, just not high enough. It's going to spread a little slower, except in those very patient populations that are very vulnerable.
Measles is one of the most infectious diseases, and there's no antiviral medication that can cure it. Health officials continue to say that the best and safest way to protect yourself is by getting vaccinated.
It keeps you from getting real sick. You still might get a little bit sick, but remember, your body's immune system now knows what it looks like, and it's ready to do battle.
Doctors say there have been no reported deaths as a result of the vaccine. Not getting vaccinated can leave you susceptible to the virus and further complications, including pneumonia, encephalitis, deafness, impaired cognitive function, and
there is a very rare but very serious complication that can occur, a subacute sclerosing panencephalitis.
SSPE tends to occur 7 to 10 years after being infected with measles. It's a progressive and incurable brain disorder that causes mental deterioration, muscle jerks, and seizures.
And the way to prevent all of this from happening is to be vaccinated.
Young children are considered the most vulnerable to measles, which is why local health leaders have decided to update vaccine guidelines, encouraging an early dose for newborns as young as 6 months. Newborns have some antibodies passed to them during pregnancy, but they don't last forever.
Those antibodies last till about 6 months of age. And then after that, they start waning a little bit. They start falling off, and they don't protect as much.
The state health department confirmed 561 cases of measles earlier this week. We expect new data tomorrow. The Texas outbreak, which started in January, has nearly 2 times the number of cases that were reported across the country last year, according to the CDC. 3 people, including 2 children, have died. All were unvaccinated. Karen and Abner.